more of a consequence rather than correlation. While doctors are leaving the Philippines for valid reasons, major reason of which is, I think, financial, but there are valid reasons. The consequence is we lack doctors now in the Philippines, especially in the rural or underdeveloped areas. The government has to do something about this really. Lalo na ngayon na umpisa pa lang yung problem. Well, one way is to increase the salaries of government doctors. Majority of doctors leaving the country, I feel, are those who work in the government hospitals, or they are government doctors because of the low salary. So one way to resolve this is really to increase the salary of these doctors. Internal medicine. I've interviewed a lot of doctors and in my friend doctors in the States, and one of the subspecialty of medicine which is in demand is neurology. Even in the States, their graduates they don't like they don't like the field. So I feel neurology is one of them. In the medical field, in demand in the States. If I'm not mistaken, it's around 2,000 to 3,000 US per month.
Oh, okay. So is there a big percentage of
That's for the beginners. For the beginners, yeah, beginners. Of course, they will earn more if they are specialized. When I say specialized, if you're a neurologist, it's higher now. I would not say big. Maybe, if in my opinion, at most, maybe 15 to 20%. At most. The main reason why they want to go out of the Philippines is, of course, mainly financial. If you know the salary of the government physician here, it's really very low. You cannot sustain a family. A government physician is earning only about 15 at most to 30,000 a month, and they go on duty every 3 days, and they cannot have their own private practice. So it's a very low salary. Now, why go into nursing? Because that's the demand now. Not only in the States, but even other countries. They lack nurses. They want services of Filipinos because Filipinos really care for patients very much. And they have low salary compared with an American nurse. So that's a stepping stone. But they have valid reasons. Major reason is really financial. No, it's not really the demand of medical practitioners. I don't think there's a demand of medical practitioners abroad. Nurses maybe, but medical practitioners, I don't think so. These hospitals are closing because they're, like I said earlier, the government doctors are not well paid. They're working so hard, but the salary that they get is not equal to the work that they give. So what they do is they study nursing and apply as nurses to go abroad. It's not really that demand in other countries. Tinatawag natin brain drain. Nade-drain yung magagaling nating mga doctors because they leave the country. And yung mga pasyensya natin na doktor sa government hospitals, they're not well paid, so they really have to support themselves then, so they leave the country. What the government can do, they have to find a way to increase the salaries of these doctors. Otherwise, that's the main reason why they leave the country. We have a lot of good government hospitals, especially in Metro Manila. UPPGH is one, although it's a semi-government, but it caters to almost all part of the Philippines. We have Jose Reyes Memorial Medical Center, East Avenue Medical Centers. These are in Metro Manila. But in the rural areas, we also have public hospitals for each capital of a provincia, of a province. But the rural hospitals are not fully equipped, unlike in Metro Manila. But they can cater to our people, our patients, Filipino patients. It really boils down to the salary. You have to have a law regarding what's the right amount to pay the government doctors. For here in Metropolitan Medical Center, which is a private hospital, if you are a nursing graduate and you apply here, during your first year, let's say graduate ka lang, no, not so much experience yet. During your first year, your salary would be less than 10,000 pesos. Less than 10,000. Yes. Some of only a few pesos more, my secretary's salary will be equivalent to the nurse's salary.
So, therein is
That's nursing,
private ba?
Private pa yan.
So, pag public, mas
Well,
marama.
sa public kasi, they have the benefits, no? Unlike sa private, lesser benefits, no? Sa government, they have yung hazard pay, different other government benefits that the government gives. Yun ang maganda ron. But still, if you're a physician or a doctor, it's not enough. It's not enough to sustain a family. Personally, I would still love to serve the Philippines. Iba talaga, no? Kung sa Philippines ka nagsiserve. Secondly, if I will work abroad, for example, if I want to work abroad, I would like to work as a physician. I will not enroll again to become a nurse and then go and work as a nurse abroad. But as a physician abroad, personal opinion, no, I will not. I will still work here in the Philippines.
Ano po yung benefits na yung nakakuha in working here?
In the Philippines compared sa abroad?
Ano yung gusto mo dito?
Well, in terms of patients, no, mas kilala mo na yung pasyente rather than abroad. I am not saying all, no, but some countries tend to discriminate. If you're an Asian and then you work in some areas with discrimination, you will get disappointed. Unlike here in the Philippines, they don't discriminate. The Philippines, we produce a lot of good doctors, and if you look at some of the hospitals abroad, even the heads of a department is a Filipino doctor. So we produce a lot of good doctors. Unfortunately, they have other reasons why they want to work abroad. But for government doctors, the main reason mainly is financial.